beautiful people, and welcome to another video. This video is going to be talking about why do you have painful period cramps, and it is going to be the start of a series, so let's jump into it. Okay, so before we dive into exactly why you have painful period cramps, let's do just a little bit 101 or period 101, I guess. Your menstrual cycle occurs after the luteal phase of your monthly cycle, and it can last anywhere from 3 to 7 days, and your menstrual flow in itself can be a variety of different flow levels, and it can fluctuate throughout your menstrual cycle. You can have light days, moderate days, and heavy days. All of that just depends on a variety of circumstances within your unique body and with your unique health. Now, when it comes to experiencing the unpleasant part of the period, which is the cramping part, this is caused by prostaglandins, which is similar to a hormone, and it's secreted to basically help trigger the uterus to begin to contract in an effort to help your uterus expel that lining and get it out. Now, periods are not painful and pleasant for many people. A variety of women can experience different levels of pain and discomfort during their period, but when your period is excruciatingly painful and uncomfortable, and it is preventing you from functioning and performing in day-to-day activities because of the pain and the symptoms you're experiencing, that is something serious, and that is a problem, and that is not normal. I repeat, it is not normal. And one of these reasons that you could be experiencing excruciatingly painful periods and experiencing killer cramps and all of the side effects and the symptoms that come along with that is due to a condition called endometriosis. So endometriosis is a condition in which tissue that normally lines the uterus, which is called endometrial tissue, instead of lining the uterus, it begins to line or find a place or find a home elsewhere within the body where it grows, it thickens, and it sheds. Displaced endometrial tissue is commonly found on the ovaries, the fallopian tubes, the bladder, the bowels, and other organs within the pelvis. Now, just as I kind of mentioned before, the issue with this displaced endometrial tissue is it's still operating and it's still responding to the rise and fall of estrogen and progesterone. So it's still acting the same way as it would if it were lining the inside of your uterus. So that means that it's operating on the same monthly cycle that the lining within your uterus is operating off of. And it's responding to those hormones the same way the endometrial tissue within your uterus is responding. So that means that it is growing and it is thickening and it is also shedding. And this is part of the reason why endometriosis is so god-awful painful. It's because when your body is going through the process of shedding and trying to get rid of that endometrial tissue, it doesn't have any way to go. It doesn't have any place or any way to escape from your body, and that's when it starts to cause issues with irritation, pain, and inflammation within the body. Common symptoms associated with endometriosis is going to be nausea, vomiting, diarrhea, constipation, low back pain, intense pelvic cramping, which is also known as killer cramps, heavy bleeding, bloating, painful bowel movements, and painful urination as well. It is also common for women that have endometriosis to not only experience these symptoms during their period, they may notice that they experience these symptoms during ovulation, and in a lot of women with endometriosis, they can experience these symptoms throughout the entire month. So throughout their entire monthly cycle, they may be experiencing these symptoms. So let's talk about what you should do if you have painful periods and you suspect that this may be because of endometriosis. One of the first things I like to recommend that you do is to track and log and monitor all of your symptoms for at least a period of 2 to 3 or preferably 6 months if you can. That way, when you do go to your doctor, you can tell them point by point exactly what you've been experiencing, what you've done to help with the pain, how long this pain lasts, all of the different things, so that way you can give them a full picture of what is going on with you, so they can properly identify what's going on with you and get the ball rolling on giving you a proper diagnosis and helping you. I also encourage you to have honest and very open conversations with women within your family. So your siblings, your aunts, your mother, all of those people, have conversations and talk with them about their reproductive health and their menstrual history, because there's a higher risk of you having endometriosis if you had a sibling or you had a mother that also experienced endometriosis. This could increase your risk factor of also having endometriosis, and it's important that you know that so that you can then communicate that to your doctor as well as part of your overall health history. And you also want to make sure that you're discussing that with your doctor and including that when you are meeting with your doctor and talking with them about what you're experiencing and what is going on. So that is all for this video. I hope that you found this super informative and super helpful. If you did, go ahead and hit that thumbs up button, and also make sure you're subscribed. If you're not subscribed, go ahead and hit that subscribe button and make sure you ring the notification bell. That way you do not miss any of the videos that I upload here on this channel. And until next time, here is to Defying Aging and Redefining Fertility. Bye!